Hi guys, one of the most difficult things to handle while taking care of a patient in Nigeria is their beliefs. It could be religious, it could be superstitious, it could be those beliefs handed down from their parents or what their neighbor told them. Very, very difficult to handle. One of such beliefs in Nigeria is cryptic pregnancy. And I'm going to tell you a story, my personal encounter a few days back. And before that, I'd like you to subscribe to this channel, like, share, and don't forget to turn on the notification button like this. So a few days ago, a middle-aged woman walked into my office and I attended to her, and then I prescribed some medications for her. And then she asked me, "Doctor, I hope this drug prescription will not affect my pregnancy." I was like, "Wow, are you pregnant?" She said, "Yes." I was so confused at that moment. And then I asked, "Have you done a pregnancy test?" She said, "Yes." "Was it positive or negative?" She said, "Negative." And I asked, "Have you done a scan?" She said, "Yes." "Did they find anything in your womb?" She said, "No." And I got more confused. Cryptic pregnancy simply means to them hidden pregnancy. It cannot be detected by any ultrasound scan.
That's not the definition of cryptic pregnancy.
Now, cryptic pregnancy in the real sense simply means being pregnant without knowing that you're pregnant. Most of these women can be pregnant without having the typical signs and symptoms of pregnancy, and they may carry this pregnancy up to the day of their delivery and they start having contractions and labor pains. However, when an ultrasound scan is done, it will surely detect a fetus in the uterus, in the womb. So there's no way that baby will be hiding somewhere.
You can call this something else, but it's not a cryptic pregnancy.
If the baby is hiding somewhere outside the uterus, that means it is an ectopic pregnancy, which is an emergency. Now, the thing is, she's been looking for a child for a very, very long time, and she actually believed anything. And then she fell into the hands of fraudsters, doctors who are fraudsters, or doctors who are actually, they don't care. They just want to get the money. And then you can also have fake doctors who just brainwash them. So what these guys do is that they intermittently inject them with synthesized pregnancy hormones like estrogen and HCG. HCG is human chorionic gonadotropin, and that is what the pregnancy strip usually detects. And when they go to the lab to test, and it usually comes out positive. And then there are other medications that can actually give you elevated HCG, and then when you do your test, it can come out positive. So we have false positive in these situations. And for the estrogen, it gives them this feeling that they are pregnant, feel them, make them bloated, makes them, gain weight, and then they feel like their uterus is increasing in size and all that. So this is the effect of the estrogen. Now, there are two sides of the story. The first one being that this woman knows that she can never get pregnant, or she's done everything and knows that she will not get pregnant. And then she goes to this doctor who is a fraudster, and she, without thinking, just accepts that she's pregnant so that she will deceive the husband and agree. And then somehow, on the day of delivery, they'll perform magic. The second side of the story is that these guys are very, very good. I mean, these fake or fraudster doctors are very, very good. They actually brainwash their clients and their victims and, tell them things and all that. Tell them that this pregnancy can never be seen with an ultrasound scan, no matter what. All right, see how it's done? And then they keep taking this estrogen, HCG, and other synthesized pregnancy hormones until the 9th month. And then on the 9th month, they tell them that they're going to do CS for them, cesarean section for them. And what they do is that they knock them out with general anesthesia, and then they bring a newborn baby that has been smuggled from somewhere, and they give it to them, and everybody rejoices that, oh, our baby is here. Fake.
Fake.
Right. Let me shock you. A recent study carried out in Nigeria showed that more than 25% of fathers who go for a DNA paternity test are actually not the fathers of those children. That means out of 100 men who go for that test, more than 25 of them, I commend my reserve. When you're pregnant, there should be every evidence, not just the pregnancy test strip, urine or blood. There should be a scan evidence.